HCG, also known as human chorionic gonadotropin, is a hormone which lies within the blood and urine of a woman. Human chorionic gonadotropin is a hormone that is used to determine whether or not a woman is pregnant. Once conception occurs and the fertilized egg implants itself into a woman's uterus, the HCG hormone begins to produce through the rudimentary placenta. In order for a woman to receive a positive pregnancy test, it's imperative that implantation occur in addition to the production of HCG. Predicting HCG levels is not as easy as it may appear. If implantation has not occurred, HCG will not be produced, or a home pregnancy test may not be able to identify HCG levels in your urine until HCG levels have had a chance to accumulate within your body. Producing HCG within a woman's body takes time, and it may take a few days or at least a week until a woman will have HCG in her body. So how does a woman determine if her HCG levels are normal? Countless women may be terrified when they hear their HCG levels normally double within 48 hours during their first trimester. However, what women may not fully understand is that HCG levels often double at a much slower rate than this, and that can be normal as well. In order to determine if your HCG levels are rising normally, there are a few things you must know about how HCG levels typically rise. Depending on your levels, for example, it can take several hours or days for levels to rise. Therefore, if a woman's HCG levels are below the 1200 mark, it can take between 2 or 3 days for her levels to double. If HCG levels are between 1200 and 6000, it may take up to 4 days for these levels to double. Levels above 6000 may also take approximately 4 days or possibly more to double. This time frame is perfectly normal. It takes time for HCG levels to rise at a steady rate. After an 8-week period in time, a woman's HCG levels will begin to slow dramatically and eventually decline. This change is normal as well. It's important that you receive your HCG directly from your physician. There are a lot of women who are told by their specialist that their HCG levels are rising slowly, yet they do not know the exact rate or number. It's imperative that you ask your physician about your HCG levels and know how many days have passed between each test. Another option to determine your HCG doubling time after you meet with your physician is to find an HCG calculator online, which is widely available. It is imperative that you do not overanalyze or become scared if your HCG levels plateau or decline temporarily. Throughout research, declining numbers may indicate a variety of reasons as to why this may occur. Though it is not the case for every woman, slowing or declining numbers may determine a miscarriage, dehydration, or other factors. 1/3 of women may bleed during pregnancy, so expect numbers to temporarily slow down or drop off completely. Remember that numbers that are declining do not mean a miscarriage will be certain, for a decline may only be a temporary occurrence. In an average or typical pregnancy, HCG levels will start to plateau and eventually decline as a woman becomes closer to the end of her pregnancy. It is for that specific reason that many physicians do not check HCG levels during this time, as numbers will vary from woman to woman.